So this concludes the presentations by our panelists. I want to once again thank all the speakers for their really wonderful, thoughtful, useful presentations. We now have a time set aside for public comments. So I first want to ask, is there anybody here in the room who wishes to make a public comment? I'm sorry, I'm staring right at that spotlight. If you could come to the mic and just give your name and affiliation, if any, and we do ask you to limit yourself to, Robbie, how many minutes? 2 minutes, please.
Hi, thank you. My name is Trish Koussis. I work at FDA CEDAR, Office of Translational Sciences, and we just wanted to take a moment of the committee's time to let you know about a new project that just launched recently in the last couple of weeks. And we funded this project by a collaborative agreement through the FDA CIRSE program. For those of you who don't know what the CIRSE program is, it stands for Centers of Excellence in Regulatory Science and Innovation. The group conducting this study project is Yale and Mayo, and they're leading it, and they're working on the protocol as we speak. So the focus is really trying to, and definitely to gather real-world data on acute pain patients in diverse populations. That's making sure we're including minorities and rural populations as well. We are focusing on emergency departments, primary care settings, and dental settings. And some of the data we'll be collecting will be amount of opioids prescribed, amount dispensed, and amount that is actually used. We felt this was really important, an amount of information and knowledge to add to what's already out there and what's currently being collected.
Great, thank you very much. Any other people wishing to speak? And Robbie, I take it there's no one from the internet who expressed interest in making a comment. Okay, so with that, I'm going to just once again repeat my thanks to the speakers, to the committee members for their insightful questions. The public meeting is adjourned. The committee is going to adjourn for a deliberative session in the other room or through the Great Hall and around. Why don't we gather there, Robbie, in about 5 minutes? Will there be coffee at that room? We have to get our coffee on the hook. Okay, I'm a communitarian at heart, and I think that if there's coffee at any NAS function, it should be for all NAS volunteers.